Good afternoon, everyone, and welcome to PDCN's International Day of People with Disabilities online forum. Before I begin, can I take this opportunity to acknowledge the traditional owners of the many lands on which we meet today and pay my utmost respects to elders past, present, and emerging. As I'm sure you're aware, this year's International Day theme is Building Back Better towards a disability inclusive, accessible, and sustainable post-COVID world. This year has been an exceedingly tough one for all Australians, not least people with disability, as we all navigated isolation, physical distancing, face masks, and other increased personal hygiene requirements, and many other challenges. For some, staying safe meant locking down completely and finding new ways to support our daily needs, from care provision to food supplies, our work environment, schooling, and social networking. On the whole, Australia has fared better and much better than most of its international counterparts. And whilst I, for one, will miss being able to do international travel for quite a while, I feel incredibly lucky to live here, and in New South Wales in particular. PDCN has worked hard throughout this year to address some of the deficits we saw for people with disability in the initial planning for COVID-19. Successfully working with New South Wales Health to ensure people with disability, particularly those outside the NDIS, had access to personal protective equipment, or PPE, and that an ethical protocol for the provision of life-saving ICU equipment in the event that demand outweighed supply happened. We lobbied to ensure people with disability could access home deliveries for groceries and medications, and for an additional supplement to the disability pension to ensure that additional costs of COVID didn't further cause hardship for those already living below the poverty line, though unfortunately we weren't successful in that last piece. However, it took some time, and perhaps a little longer than it should, for people with disability have now commented on the upsides to a COVID world, and that's what we're here to discuss today. Not everything's perfect, but some changes made throughout this time have made the community in which we live a better, more inclusive place for people with disability. And today's discussion will delve into the positives, the things we should keep or continue to improve going forwards. To that end, we have a fabulous panel of both sector experts and people with disability who will talk through their unique experiences and learnings, particularly in the area of education, health, and communications, and what they see as vital processes to keep in what eventually will be a post-COVID world. I won't introduce all the panelists now, or the forum will be over before it starts. But before we do move to our first panelists, can I remind everyone that we'll have time for questions at the end of the forum. So please put any question you might have into the question and answer text box, not the chat, and we'll do our best to answer them during the question time session. To get us started, I'm pleased to be able to run an introduction from Australia's Disability Discrimination Commissioner, Mr. Ben Gauntlett. Ben sends his apologies for not being able to be here in person, but previous commitments on such an important day conflict with our timing. However, he was able to pre-record his message for us, so here's hoping technology works and we can view it now. No sound.
There are a few speaking requests that come across my desk. I do, though, look forward to hopefully catching up with many of you in person in the near future, or, as is the way with COVID-19, online. I should start, though, by acknowledging the traditional owners of the land upon which we meet. I pay my respects to the traditional owners of the land where I am today, the Gadigal people of the Eora Nation, and I pay respects to their elders past, present and emerging, and acknowledge their continuing connection to this country. I also acknowledge all other Aboriginal and Torres Strait Islanders, elders and community members who are here today. It's been an incredible year for Australia, but in particular, I think has been an incredible year for people with disability. In a sense, the bushfires will be looked back on as not that significant an event because of what has occurred as a result of COVID-19. The health response to COVID-19 has meant that the obvious fault lines that exist in the disability policy system have been easily seen. COVID-19 has the effect of exacerbating disadvantage. It is an enormous challenge going forward to ensure that people with disability remain to be treated in a way that is respectable and acknowledges that they have dignity and the risk to make decisions which are in their best interests, in their opinion, not someone else's best interests. On International Day of People with Disability, I often like to reflect upon what are the gains that have occurred in relation to disability rights, but also maybe to reflect upon also what are some of the needs that we need to do in the future to ensure that we have a society where each and every person is valued, irrespective of disability or no disability, gender, race, ethnicity, sexual orientation, or whether they live in a metropolitan or rural and remote area. And I think when I look at some of the gains that have occurred in relation to ensuring, for example, that new buildings have a basic level of access, that there is an awareness of communication disability, that there is awareness of the need for accessible communications, that needs to be very much balanced with the practical outcome, which is that whilst there is now an increasing awareness of these issues, there's not always an understanding of how to implement the policy to ensure that each and every time we need something to incur to ensure substantive equality and true inclusion, that it's in place. And that's a challenge for all of us going forward. I think for disability policy in this country to move forward in a way that is going to have a lasting legacy, we need to normalise disability policy. And by that, what I mean is that when we have ministers at a state or federal level or members of local government discussing issues, they don't just discuss issues for people with a disability or for people who do not have disability. The disability is seen as a cross-cutting policy area that is important. An example of this is employment, where the employment of people with disability both makes economic sense and is justified on human rights grounds, and in particular the employment of people with disability ensures that those organisations that employ them often create more diverse and intuitive products, and co-workers of the people with disability often respect the organisations for allowing that person to be their true selves at work. But to normalise disability policy more generally, we have to be very careful to end segregation. Segregation in employment, segregation in the justice system, segregation in health. We need to understand that segregation is not the answer to having a difficult policy issue to resolve. We need to be able to articulate why segregation causes lasting problems in society. And to do that, to normalise disability policy in Australia going forward, we need younger members of the disability community to feel confident and comfortable enough to communicate their wishes, to say, this is the Australia I wish to see and why. And to articulate why that is in a manner that's both well thought out and considered, but also forthright, where they say that this is not good enough, where they're comfortable saying we need things to improve. And for that, people with a disability who might be older or have been involved in a disability rights movement for a long time need to give space to people to be able to be heard. In terms of the Australian Human Rights Commission and what we'll be doing in 2021, obviously the National Disability Strategy is an incredibly important issue which we're alive to. We responded to the position paper that was released, and we held an online seminar relating to the National Disability Strategy, and there is a need to meld both the strategy and the outcomes framework to ensure that it reflects the Convention on the Rights of Persons with Disability. But within the National Disability Strategy, there is another important policy issue that we want to pursue, which is the National Disability Data Asset. And that National Disability Data Asset will hopefully enable good infrastructure to be created, informational infrastructure that ensures good policy can be created for people with disability for generations. The other three issues which in a sense fall out of the National Disability Strategy and the National Disability Data Asset are community awareness. We want people with disability to be viewed in a favourable way in the community. We need a strengths-based approach to ensuring that people with disability not only are looked after in terms of a perhaps personal care setting, but also that people with disability are in a position to get jobs, to own houses, to run businesses, to live a good life. And for that to occur, we need to be very careful that the community awareness activities that are undertaken by government and disabled persons organisations look at people with disability in a way that is reflective of what is the strengths that they bring to society. As part of understanding the role of people with disability in society and inclusion, housing is also an important issue. We need people with disability to be able to move into houses which are accessible. The justification for this is obvious in that it not only enables them to live a good life, but it often reduces the cost of people coming to assist them if they need that. And in particular, if someone gets old and they suddenly need accessibility, if the accessibility is built into the house, it's 22 times cheaper. And that's an important figure to be aware of. Not only is accessible housing good from a human rights point of view, it's also incredibly important from an economic point of view. And the final area that we want to really look at and push hard is employment. We rank 21st out of 29 in the OECD for disability employment and last for people with disability and poverty. We need to create a culture where the largest organisations in Australia look at disability employment as they would any other diversity characteristic, and they want people with disability not just to get a job, but a good job. I might then leave you with perhaps a concluding thought about the importance of disability and pride. US President-elect Joe Biden said when he acknowledged that he was going to be victorious in the presidential election, "We must make the promise of the country real for everybody, no matter their race, their ethnicity, their faith, their identity, or their disability." It was the first time in a presidential acceptance speech that an individual had mentioned disability explicitly with other diversity characteristics. A number of online platforms went wild. We need to get into a position in Australia where the mentioning of disability in a conversation is not the abnormal, but it's just a done thing. So I look forward to hearing about today. I look forward to understanding what is some of the views that are being expressed to the Physical Disability Council. And above all, I look forward to celebrating International Day of People with Disability. And I wish you a very good day and hope that it is one which is meaningful and will lead to better things in 2021. Thank you.
Thanks to Ben, although I apologise, the sound is quite low. We've got it up as high as we could, and I understand that it was quite soft for some people, so please, our apologies for that. The original recording was difficult to work with. Our second panellist is Ms. Susan Thompson, Vision Australia's Advocacy Advisor, and who I would call a pocket dynamo. Susan has significant experience as an advocate, previously working for Blind Citizens Australia, and also provides advice on committees such as the New South Wales Accessible Transport Advisory Committee for Transport for New South Wales and the Equal Access to Democracy Reference Group. Susan is totally blind, lives independently and has done in both Alaska and Australia, and has travelled extensively across the USA and Europe. Technology is a huge area of interest for her, and I'm keen to get Susan's perspective on what we can take forward from this unprecedented year. Welcome, Susan.
All right, am I online?
You're good to go.
Okay, thank you so much. Thank you very much for this wonderful opportunity to participate in this event today and to share my mostly personal experience interspersed with, some of my experience as a member of the disability community. As Serena said, I am totally blind. I was born out of the rubella epidemics that were present in the 1950s and 60s, which resulted in me having at that time very low vision, a hearing impairment, and some of the other medical conditions that come with congenital rubella syndrome. So it's quite ironic that I'm here today talking about the impacts of another contagious virus. It's been a roller coaster of a year. I think the Queen had a much more eloquent way of putting it once upon a time. But those of us with disabilities have had to try and survive, stay healthy, both physically and mentally, and try and come out of this all relatively unscathed. I think one of the positives is that it was opportune that COVID came along at a time when we were in the midst of a Disability Royal Commission, and we therefore had already established mechanisms which could specifically look at responses to COVID-19 and inclusion of people with disabilities and other emergency responses. Before I can look at some of the good that I think came out of this COVID, the responses to COVID, I don't think that we can ignore and learn from some of the things that weren't so good. If we rewind back to March, the media was already reporting the threat of COVID, and it soon became known that governments would be to impose lockdowns, which would have a profound impact on all our lives. The availability of groceries was starting to become an issue because of binge buying, which is a problem for those of us who needed, personal assistance to shop. And the online shopping system had to re-gear itself for an altered operating model. Fortunately, the supermarkets did implement, I think, what was called a disability hour, which again was a great help to those of us who needed somebody to assist us with shopping. But the delivery system was a little while catching up, and basic supplies were often still limited, as were available delivery windows. The initial announcement coming in, I think March 15, that lockdowns had started. As someone who is blind, living alone, and not being able to drive, this is the first time I experienced almost paralyzing fear. I wasn't so much worried about catching COVID, although obviously that didn't thrill me either, but I was really concerned about possibly starving at home in my own house. Fortunately, my sister was able to reassure me that, all other places in the world that had started lockdowns, you could go out shopping. I've continued to experience some sort of ups and downs in my frame of mind over the intervening months, most of which were impacted by my reticence to go out. As someone who's blind, it's much more difficult to control other people's social distancing with me, and added to that, I rely a lot on touching, and then after that, rubbing what is often itchy, dry eyes, obviously was a really bad idea. But the clincher was that I felt I had to be almost dead before I got tested. The New South Wales Premier kept saying, oh, you should get tested at the slightest symptoms. Well, I would challenge a government official to be someone with a disability who can't drive, needing to be tested and getting to a testing centre without putting someone else at risk. Back in April, when I had flu-like symptoms, and after some explanation, including the fact that I had NDIS workers coming in, adding to the risk, it was recommended that I should get tested. And that was quite an experience. The cab companies wouldn't take me. My sister really couldn't take me because she was a health worker amongst a vulnerable population. And the New South Wales ambulance service not only wouldn't take me, but the whole interaction with them was demeaning. And at the end they said, quote, if your symptoms change, then you have to get yourself to a testing centre. In the end, obviously, I didn't get tested. Then in October, after developing symptoms, cold-like symptoms again, I went on the roller coaster of the telephone circuit and eventually found a company which actually did do, at a pinch, send somebody along to my home to actually physically do the test and take it away for me. But this seemed to be something that wasn't well known, and as a result, I kind of feel if I had to do it again, that I would again have to be dying to take advantage of it when everyone else can, you know, just at will walk into a testing centre. So having said that, I think the other thing of note which I experienced was that as an employee in the disability sector, the NDIS rightly implemented a COVID-19 competency model with very little attention to accessibility for people using screen readers. So those were some of the things I think that, while they're the not so good things about COVID, they are things that we can learn from. And as Ben referred to, we should be building responses to these emergencies into normal thinking. Looking on the bright side a little bit, there are some really good things that have come out of COVID that that if they're continued on and improved upon, could have really great benefits for those of us with disabilities. In the medical arena, the increased use of telehealth to keep people out of medical waiting rooms means that those of us who might find getting to the doctor challenging were much more likely to have a consultation with the doctor, and in many cases face-to-face consultations were not necessarily needed. The other thing in the medical arena was that all of a sudden, miraculously, doctors started to be able to, when they often said they couldn't, use email to send information from doctor to doctor and even from doctor to yourself. And although the excuse me, although the format of the emails sometimes has some issues in terms of the whether it might be a PDF document, an image PDF document or such like, it is a really good start. The other really good thing in the medical arena has been the advent of electronic prescriptions. If you are a person who's blind or has low vision using a smartphone with either the magnification or speech output elements, accessibility elements, you can receive your prescription, see what it is, see how many repeats you might have left, and take your phone along to the chemist and almost use it like paying for something with the wallet in your phone. There have been some great health benefits for me personally. Being totally blind and having a circadian rhythm disorder because I don't get the light and dark cues to regulate my sleep-wake cycle My fatigue's obviously pretty high a lot of the time, and working from home has enabled me to manage that really well.
Really out of time, Susan.
Okay. So I think there are lots of other things. Just there are social benefits. The level that Zoom meetings can be. The QR code contact systems, provided that they're designed accessibly, and of course the benefits from working at home and the flexibility they can give a lot of us with disability. So I hope that the silver lining on the COVID cloud will be able to stay untarnished, and that these great gains can be improved upon. Thank you. Thank you very much.
Thanks so much, Susan. It seems that, as you said, catching up is the catch-cry of the year. And the added stress and anxiety that many people with disability have experienced is also one that we hear quite a lot. I'm glad, however, to hear that in some areas, people with disability, and particularly those who are blind or vision impaired, have found advantages in online facilities, as you say, QR codes, and flexibility, particularly in the workplace. Our next speaker to talk to you more on the area of accessible communications is Meredith Lee, Disability Policy Advisor at the Australian Communications Consumer Action Network. ACAN deals with all things communications and has recently built an accessible communications roadmap that explores what is required for all communication services throughout Australia to be inclusive and accessible for people with disability. And I'm eager to hear what they've seen in the way of innovative technologies that have come to light during this past year. So without further ado, let me hand over to Meredith.
Thanks so much, Serena. Thanks for inviting me to present today. I'd just like to start off by acknowledging the traditional owners of the lands on which I live and work, and I pay my respect to elders past, present and emerging. Next slide, thanks, Hides. So for those who may not know, ACAN, we are Australia's peak communications consumer organisation, representing individuals, small businesses and not-for-profit groups as consumers of communications products and services. When we're talking about communications products and services, we mean things like landline phones, mobile phones, online services, internet connections, and new and emerging technologies. ACAN has a really long history of advocating for consumers with disability in the communications sector, and we're really proud to have quite a wide range of disability organisations as members and as really valuable contributors to and supporters of our work. Next slide, thank you. So as Serena mentioned, after celebrating our 10-year anniversary in 2019 and kind of reflecting on what accessibility improvements ACAN and our members have contributed to in that time, we started thinking about what accessibility improvements we would like to see in the communications sector in 2020 and beyond. And that led us to develop the Ideal Accessible Communications Roadmap. Next slide, thanks. So we did some consultation to kind of develop this roadmap. So we consulted with our members and the broader disability sector from December 2019 to early 2020. And as part of this consultation process, we asked three main questions. Firstly, the communications issues that were currently affecting people with disability. Secondly, the communications issues that were likely to affect people with disability in the future. And thirdly, suggestions for possible solutions to address these existing and anticipated communications issues. So based on that information, yes.
Just a really quick request, if you can slow down just a little.
Oh, sorry, of course. I have so much to get through. I wanted to speed through. Apologies. So based on the information from the consultation, we developed the Ideal Accessible Communications Roadmap, which outlines our shared goals and illustrates what it would look like if all people with disability in Australia had full and equal access to communications technologies and services. Next slide, thank you. So 7 key themes emerged from the consultation, and these form the framework of the roadmap. So the themes are phone and internet services that work for everyone. So things like accessible information, plans, contracts, accessible customer service experiences. Safe and reliable communications technologies was another theme. So access to resilient communication services in emergency situations, things like telehealth that Susan mentioned, and also scam protection and cybersecurity. The third theme was accessibility of devices. So the need for industry to be upskilled on accessible devices and to have enforceable standards around the accessibility of communications products. The fourth theme was affordable communications technology, things like device subsidies or concessional products for low-income consumers. Another theme was inclusive online environments, things like web accessibility and digital inclusion training for those who need it. Another theme was accessible audiovisual content, so things like audio description, captioning and Auslan interpreting on television and other audiovisual platforms. And then another theme was general accessibility, which is kind of important whole of society accessibility changes. Next slide, thanks. So while the roadmap is a helpful document to track progress towards a more inclusive and accessible communications sector, we wanted to make sure that ACAN, our members and the broader disability sector also had a plan of attack. So our accompanying action plan provides this. So that's things like the hows and the whys and the activities that could contribute to the realisation of the shared goals that are outlined in the roadmap. The action plan consists of quite a long list of potential actions. There's a lot to get done that will hopefully progress us towards a more inclusive communication sector for people with disability. It includes a rough time frame for each action. It identifies the target of the action. So for instance, telecommunications providers or the government. And it also suggests organisations that might lead or support the work. Next slide, thank you. So that brings me to some examples. So many of the issues that were raised in the development of our roadmap and the action plan have been amplified during the COVID-19 pandemic. In the interest of time, I'm only going to speak to a few of these actions, but I'd be more than happy to speak offline with people about the whole range of actions that we want to pursue as we kind of emerge and build a more inclusive post-COVID-19 world. So firstly, digital inclusion. So this year has well and truly demonstrated the importance of being online for education, for employment, for social and cultural events, among other things. So the shift to online delivery of events and services has increased the capacity of some people with disability to engage with communities and access supports and services like telehealth, as Susan mentioned. And while some temporary measures were introduced this year to support consumers to get online and stay online, we think more is required, including sustained support for consumers with disability. Moving forward, we feel that the disability sector has a really strong case for advocating for devices that are accessible by design, for subsidies or concessions for accessible devices and home broadband products, for the extension of existing digital inclusion training programs to meet the needs of people with disability across Australia, and for targeted supports to get consumers with disability connected to the internet, no matter where they live. In our advocacy, we should look at digital inclusion holistically and consider how accessibility, affordability, digital ability, and the availability of connectivity affects how and when people with disability get online. Secondly, now is a really great time to think about the role of information and communication technologies, or ICT, in relation to employment. There have been lots of conversations about how to get people back into the Australian workforce, and implementing a whole of government accessible ICT procurement policy could play a really huge role in this, both in the short and long-term employment of people with disability in Australia. We already have an Australian standard about accessible ICT procurement. We need to be calling on governments to implement it appropriately to increase the baseline accessibility of government workplaces and better support current government employees with disability as well as future employees with disability. We also believe that a whole of government accessible ICT procurement policy could also support local manufacturing of accessible devices and open up a greater marketplace in Australia of accessible ICT for the private sector, as well as for personal purchase and use by consumers with disability. Lastly, over COVID-19 and the bushfire season, many of us will have become accustomed to seeing Auslan interpreters on our screens. It's a great time to push for greater accessibility of audiovisual content, not only in relation to Auslan interpreters, but also captioning and audio description. One way of starting this conversation could be to promote current examples of accessible audiovisual content and thank accessible broadcasters and streaming services for their increased efforts, while at the same time requesting greater accessibility from other broadcasters and streaming services and calling for these accessibility features to be embedded in legislation. I believe that there's already some work underway in this space in relation to audio description. So just quickly, for those who may not know, the sector has made really significant progress this year in relation to audio description, which has been available on the ABC and SBS since late June. Blind Citizens Australia, Centre for Inclusive Design and others have worked really closely with the ABC and SBS to progress this. There's work currently underway to update the campaign website, TV for All, with new information about a campaign focused on what I love about audio description on TV and kind of promoting a conversation about what people enjoy about having audio description. So I think this example is really crucial because, you know, when we have wins in the sector, it's so important to celebrate them and to demonstrate what accessibility improvements mean to the people they affect and to use these positives in future advocacy efforts. Next slide. And I know I'm running out of time, so I'll whip through this a little quickly. In terms of next steps, ACAN will keep seeking support for the roadmap and its accompanying action plan. We'll continue implementing the action plan and we'll use it to prioritise our advocacy work alongside, you know, emerging issues. And we'll also use the roadmap to keep track of accessibility improvements in the communication sector. And we really encourage everyone else to do the same. Final slide, just to let you know that I'm always happy to chat. So please let me know if you want to hear more about this work. And I'm really keen to work with everyone to achieve common goals and get some really great improvements as we build back better. Thanks.
Serena, you're on mute, I'm afraid.
Can you hear me now?
That's it, we got you now.
Better.
Apologies, my audio dropped out completely and I wasn't on mute. I'll start again, apologies. Our next panellist is a person with lived experience. I'm very proud to say he's also a valued member of the PDCN board. Jacob Cross is a young man in his mid-20s, going places in a big way. A town planner by profession, Jacob is also currently undertaking certification as an access consultant, and I'm keen to hear how balancing employment, studying and life has been for COVID restrictions for him. To tell us more, please welcome Jacob.
Thanks, Serena. And a big thank you to the team at PDCN for hosting this event and the invitation to speak. I'll give you a quick background on myself for those who don't know me. I'm 27 years old. I have cerebral palsy and I use a wheelchair, a power chair, sorry. I live in the Hawkesbury, and as Serena mentioned, I'm a town planner. I'm currently studying a diploma of access consulting with the Access Institute. Towards the end of high school, I didn't quite know what I wanted to do, but I knew I needed and wanted to further my education at university and begin my career. Whilst I worked out the path I wanted to take, two questions were thrown up. What was I going to study and how was I going to do it? I soon worked out that I wanted to be a town planner and eventually specialised in access. The uni I selected was great. They had a substantial student support service, which included the provision of a scribe for note-taking in class and assistance out of class. One thing I quickly found out was a lifesaver. I found that after travel to and navigating around the uni campus, I would fade in energy quite quickly. And when combining this with note-taking, was truly a difficult task. To clarify, it takes a surprising amount of energy to travel in a wheelchair in a vehicle, especially an old taxi with worn out suspension and poorly maintained roads. Having a scribe was, I'd say, one of the most important aspects to my study and my academic successes throughout the 6-year course. It allowed me to completely focus my attention on listening and absorbing information, knowing that I had all the important information available to review after class. This year, I knew was the year to further my career with beginning the steps to further my qualifications and start the journey to becoming an access consultant. I knew that the course would be quite different to the uni degree, quite short but intensive, with lots of information provided in a very short time frame, which again threw up the question of stamina, which initiated when I thought back to my uni days. I knew there wasn't going to be the same kind of supports offered with regards to a scribe, especially with the course being entirely run virtually. This made me slightly concerned, but after the year we've had, I knew it was something I should just give a go. And you know what? It's actually turned out to be a great experience. What I have found conducive to this is that there's no travel involved, which has resulted in less stress with arranging transport, calmer mornings, and overall less energy drain. Another bit of it has been the course materials have been electronic and easily accessed and annotated, something which I've enjoyed engaging with. I'm finding that having everything online really suits my learning style, which is to absorb and then reflect. While constant note-taking is really not practical for me, mainly due to the additional energy that's required to control and focus my movements, having all the material available electronically with no additional organization allows me to make quick notes to easily reflect and expand upon later. This year's uprise of our increased use of technology and the virtual world in our everyday lives has again highlighted and further strengthened the importance the role technology plays in the lives of people with disability. In my case, I feel it has provided me a more even playing field and has allowed me to explore my abilities and break out of my comfort zone while not being significantly disadvantaged. This I see is something that has been accelerated by the need to be dynamic in our responses to adapting our lives around the barriers caused by COVID-19. It's great to hear the discourses being shared by different sectors in our community around the adaptation to a world which utilizes technology more and more to connect and carry out the interactions and transactions that once occurred primarily face-to-face. I think that this will not only benefit the whole of our society, but will enable people with disability to shine through and show that, given the opportunity and a little support, we can contribute equal, if not greater, views and opinions as stakeholders in the discussions that matter the most, such as policy development. The fear I have, though, is that once we break free from the clutches of COVID-19 and begin the transition back to a more normal world, whatever that may be, we not so much start going backwards, but reduce our current interaction with technology and its integration with our lives. This is where I feel we need to grow and advance our processes to allow us to continue to have technology play a more significant role in our lives and ensure everybody has equal access to and the support to use this technology. Before I go, I'd like to leave you with a quote by Robert New, which not only resonates with me personally and my hesitations to study virtually, but I think is something that can help others with disability when they feel there is a barrier stopping them doing anything. Sometimes what you're most afraid of doing is the very thing that sets you free. Thank you.
Thanks so much, Jacob. Great to hear that online processes, particularly in education, work for you. Although something I took out of that was you don't like getting up out of bed and moving out pretty quickly. To continue on the theme of education and a younger perspective of the past year, we're really lucky to have high school student and wheelchair user Cormac Ryan join us on the panel. For those of you who don't know him, and he's a bit of a disability pin-up boy, though he'll hate me saying that, Cormac is also an up-and-coming wheelchair track athlete and one to keep an eye out for future Paralympic Games. I'm pretty sure Cormac would say he's a typical teenager and not one to consider himself in any way different from his peers, but I'd be keen to see if COVID changed his point of view or provided advantages for him this year. So over to you, Cormac.
Thanks, Serena. Just a little bit of an introduction for those who don't know who I am. I'm Cormac Ryan. I'm in year 8 this year. I go to Rosebank College and I do wheelchair racing with Wheelchair Sports New South Wales. This year we had nearly one whole semester off in lockdown in online learning. Some good and some bad came from that, but it definitely brought about a lot of change. Our whole school was moved online and at home instead of in a physical environment with classrooms and teachers there by our side. Personally, I think we did really well in that the teachers were really well prepared and really well communicative in terms of what we needed help with, because it was a new experience for them as well. I think I didn't really struggle later on in the process. It took me a couple of weeks to get used to, but definitely got me better in terms of independence with my learning and putting things into perspective of what I need to get done and when I need to get that done by. I think the teachers were pretty good and kept us on top of our work. But school wasn't the only thing that was impacted by COVID. My sport, my weekly training was suspended from our whereabouts where we normally have it. So we were forced to go online for about 7 weeks. Our coaches did really well. They kept in touch with us again, like my teachers. They emailed us every week and asked how we were, kept in. And we had the normal length session. So it was about an hour and a half session on Saturdays, but it was on Zoom. My coach, Louise Savage, she had everything planned out, ready to go. So she did it as normal, coached us. Same with my other coach, Glenn, on Wednesdays. We adapted to that pretty well and we got used to it after a while, but it was good to get back into it a couple of weeks ago. I definitely did feel for a while there that my fitness did decrease a little bit, in that I wasn't sure whether I was allowed to go outside and go for a push. The track was closed for a while, but I felt like I did keep myself occupied, and maybe I could have used my time a bit better. But yet again, that goes hand in hand with teaching me independence from this lockdown. I believe that it wasn't the moment of my decreasing fitness only lasted a couple of weeks. I got back into the swing of it after a while, with the help of the people around me. My whole family stayed in lockdown as well, and they definitely helped. My mum and I and my sisters built a home gym, so that definitely helped out with keeping fit and keeping occupied during the long time inside, not socializing with the people that we normally would. But for those people that we didn't get to see, we did try to stay in contact as much as possible, and we did. So we'd maybe see our friends from school twice a week, but we kept in contact almost every day. I thought it was pretty successful in that. Sorry for the background noise. I'll just keep going. I thought that I protected myself pretty well, and everyone around us was pretty well informed about what the requirements were for the time being, wearing a mask, social distancing, and stuff like that. So there wasn't any risk there. But we definitely had to learn that and take that on board as young people by ourselves, again, teaching us independence and getting us into new habits, which I felt was one of the main positive points that came out of COVID-19 for young people. Again, independence, 100%. Definitely, it taught it character building. It definitely taught us to adapt to the world around us and not wait for the world to adapt around us. We had to take that within ourselves, and we had to do what's best we could to make sure we were doing the right things. Yeah, I reckon that was pretty successful in spreading that around to young people. Also, more specifically with social distancing, I believe that the access for people living with disabilities improved a little bit in that if there wasn't a way around a public place with a lot of people in it, people were very well informed, they stayed in lines, and it was very well spread out, and it wasn't like the hustle bustle that you see now without the social distancing. So I believe in that way as well. COVID has changed the way young people with disabilities get around and access places. I definitely felt that going to a couple of public events during lockdown. It was definitely better and more organized than it normally would have been. But unfortunately, it was under not the best circumstances. So I hope we can stick to that and see that in the future as well.
Thanks so much, Cormac. I've got a couple of questions for you, but I'll leave them to the question and answer because I know a little bit about what you've been doing innovatively when you've been training with your friends online. My next panelist, and we're running a little behind, so I'm going to get cheeky and ask them if they are able to shorten their time a little bit. It's not your fault, but we'd appreciate it. Cecile Sullivan-Alder is the Executive Officer of Family Advocacy, a leading organisation supporting families to promote the rights and interests of people with disability, and particularly developmental disability, and a huge proponent of inclusive schooling for everyone with disability. 2020 has been a really challenging year for the education sector and students alike, but this year's brought about positive changes in inclusion as students homeschool in a highly online environment. What should we take forward from this in 2021? I'll let Cecile tell us more. Welcome, Cecile. You're on mute.
Mute, unmute. Beautiful, can you hear me now? Hello?
Yes, we can.
Oh, beautiful. Okay, thanks, Serena. Look, great to be here today to acknowledge the importance of International Day of Disabled Persons. The annual theme, as Serena discussed, is around building back better. And certainly the overarching focus each year is around how we can strive for inclusivity for people with disability generally. Today I'm going to be focusing on COVID and the impacts that many students with disability experienced, and share what's necessary if we're to realise the focus of the day, which is authentic inclusion with people with disability. Before I get going, I would absolutely like to pay my respects to the traditional custodians of the lands that we're all on. And I acknowledge our appreciation for the First Nations people and their continuing connection to land, water and community. There's a lot we can learn, and pay our respects to the elders past, present and emerging. And I'd like to welcome any Aboriginal and Torres Strait Islanders that are here today with us. I'll change slides, Heidi, if you don't mind. Now, a little bit about who family advocacy is. Serena covered that. Certainly what I'd like to say, though, is that we've been around for approximately 29 years and were founded by family members that came together because they actually wanted similar things to other people in society, and very similarly to the International Day of Disabled Persons aspire to, which is around people having access to a regular school, access to holding a job, living in a home of their own, and just the general things that we all experience in day-to-day life as Australian citizens. If we jump on quickly, Heidi, to our initiative, just briefly, we've got an initiative called Resourcing Inclusive Communities that looks at building the capacity of people, particularly around inclusive lives and innovative models of support that actually enable people to be right in the heart of their community experiencing similar things. Okay. So we're here today to talk about inclusive education, and just a snapshot, education-related calls make up approximately nearly 60% of calls that we get across New South Wales at Family Advocacy. This is pre and during COVID times. Next slide. So it's important to highlight what we mean when we talk about inclusive education, which has a strong evidence base as well as carries a legal obligation due to Australia ratifying the Convention of the Rights of Persons with Disabilities. Article 24, which relates to the education, is supported by General Comment number 4, which has been developed to provide clear implementation guidelines relating to Article 24 on education. And the General Comment talks about inclusive education, and it clarifies what it is and certainly what it's not, giving guidance to countries like Australia to actually look at reforming their systems. When the Convention talks about inclusive education, it talks about all students learning in the general education classroom and not learning in separate learning environments such as support units and special schools. The Convention also talks about all students being supported to learn the same curriculum and be supported to adapt that curriculum and each child's learning needs. And it also talks about the flexible structures and grouping of students regardless of their ability. It's important, I think, to talk about each child being valued as a community member and it included in all aspects of school alongside their same age peers. So we're talking about students learning together. And currently within New South Wales, we do not have an inclusive education system, and nor do we actually have a commitment from state government to work towards ensuring we meet our obligations under the CRPD. Further, there's no acknowledgement that segregation is in fact a human rights issue, which is why we're all here today. There is also no clear guidance for the 2,200 schools across New South Wales on what inclusive education actually is, and according to both strong evidence and the Convention anyway. In New South Wales, we still have many of these segregated settings still operating, and in some cases this is growing. And this parallel system of education continues to send strong messages that people with disabilities should be kept separate or need to be kept separate. And it perpetuates the society barriers that we're trying to overcome and works against inclusion. Okay, so what are the reasons, what actually comes about because of this current disparity in New South Wales? Certainly, for many of the families that come to us with their experience, their efforts in getting their child to attend a regular class at the local school, there's some strong themes that emerge. Things like gatekeeping, which is basically parents' children being turned around, and we've got examples such as 13 schools turning down a child before they even reach kindergarten. Low expectations of the learning of the child is quite common, and we get quite a lot of calls around that. Partial enrolment's another big one in relation to students only being allowed for a certain period of time, and this can go on for years, like 2 hours a day, for example. And micro-exclusion's another one, having access to things like excursions, after-school curriculum activities, whether it be theatre groups associated with the school and similar things, and restrictive practice. And some of us would have seen on the news last week of the young student with autism that was actually locked in a room as punishment. I'll add on a suspension from the perspective of, this is a ripe issue across schools, which really point to the whole system reform that's needed to be actually support and provide the necessary adjustments for students. Okay, so what occurred when the pandemic hit? Although it's been reported that some students, similar to what you were saying, Cormac, actually benefited from some of the effects of COVID in relation to how things changed, it appears to generally have widened the gap that already existed for many students with disability. Many families reported that there was a lack of support from school in relation to their child's particular support needs. There was also a presumption in some cases that students with disability could not learn online, so they weren't given access to online content or web classes. Poor communication was something else that was brought up is being brought up quite regularly in relation to the response from schools, from parents when they were seeking more advice and information around how to educate their child with a particular disability at home. No reasonable adjustments was another. Many parents having to then actually work out how to actually adjust the curriculum to make it work for their child. And the lack of social connections. And certainly we have had some families feedback that their child didn't have access to the same things that the other kids in the class had access to, because again, that assumption around the child not benefiting or being able to access in the same way. And low expectations generally about learning. And in some respects, content being sent home that was really kind of seen as passing the time more so than having the opportunity to learn. Okay, so interestingly, or not surprisingly, was the feedback, you've jumped, you're very good, Hardy, I must say. Interestingly, but not surprisingly, was the feedback from families in relation to success stories in the shift to online learning. What became really obvious was that students that were supported in pre-COVID times were less susceptible to experience some of the issues just highlighted. Families talked about good inclusive education practice already being in place and a part of the school. For example, teachers were already using modified curriculum for the student and had high expectations around what the student could accomplish. Another really good indicator was the successful transition was around the good rapport between families and educators and schools, and good collaboration between parents and teachers in relation to the importance that came out in relation to the information that was sent home, how things were adapted, and generally how responsive schools were to what was going on for that particular student. Okay, so unfortunately, the signs and the symptoms that have presented themselves on the course of this year are not new for many students, families and advocates. And what is promising, although, is the momentum for change in realising an inclusive education system, not just across New South Wales, but across the country. And this call for change, hearteningly, is rapidly growing. The Australian Coalition for Inclusive Education, when we're talking about building back better, is an initiative bringing together organisations that share a commitment to advance inclusive education across Australia. And AC, as it's called, is guided by a human rights framework, certainly the UN Convention, and an evidence-based approach to inclusive education. And we look to principles embodied in the UN Convention and the rights of persons with disabilities, and the core members of AC steer the work with recently formed national roundtable that works to seek a commitment from national states and territories to transform our outdated special education approach. Okay, so the AC principles is currently being supported, as I said, by many organisations across the country, as well as interested and supportive organisations and people that sit alongside that. And certainly I'd encourage anyone online or anybody that would be interested in to jump on the AC website, have a look at our information and see if it's something that you're interested in being involved in. Yep, thanks, Heidi. As part of the initial work undertaken by AC was the development of a roadmap out of the current education system. And this roadmap is underpinned by 6 pillars to help realise what inclusive education should look like, and certainly to prevent violence, abuse, neglect and exploitations of students with disability. These pillars are drawn from evidence-based and embedded in the rights of students with disabilities. And it has two main sections. One is the outcomes that need to occur, stepped out over a 10-year period, and the key levers for change needed to realise these outcomes. So again, if you visit the AC website, you'll be able to see that roadmap for change. Okay, so that wraps up my brief overview of what's going on and what's gone on for students with disability that certainly we're told by families across New South Wales. So I'd like to thank everybody for taking the time to listen and leave you with a diagram that's quite fitting to today's discussion and the day's aspiration of promoting inclusion. Segregation and inclusion do not mix. Commissioner Gauntlett talked about that right at the beginning of this session. And if we want to break down societal barriers, we need to understand what our systems do to perpetuate people with disabilities' ongoing exclusion. So let's work together to ensure that segregation of people with disability is a thing of the past. Thank you.
Thanks, Cecile. It's really interesting to hear that for some students, this scenario has been very positive, and for others, we still have a long way to go. But I think everyone is keen to work with you to get there. Our next panelist will talk about the areas that have been no more affected than, I guess, our health departments, be it hospitals directly dealing with COVID patients, medical professionals trying to deliver normal services from a distance, or our bureaucrats scrambling to ensure public health orders, access to PPE and testing processes are disability appropriate. To this end, our next two speakers will provide their perspectives on the year and where to from here. Firstly, Dr. Anthony Brown, CEO of Health Consumers New South Wales, will talk us through the year from a consumer's perspective and the innovations seen in health delivery services that have been beneficial and worthwhile pursuing. Welcome, Anthony.
That's fantastic. Thank you, Serena, and thank you everybody for the invitation to be part of this. If we could just go on to that next slide, please. So for people who aren't familiar with Health Consumers New South Wales, we're the peak body for patients and families and people who use health services. We're a membership-based charity, and we work really hard to make sure that people who use health services have a say in what those services look like and in what health policies are. And that great phrase that came from the disability movement, "Nothing about us without us," is something that really resonates with us at Health Consumers New South Wales, and it's part of our philosophy and what we really want to help make happen. So if I could just go on to the next slide, please. One of the things that, why do we want to involve the people who use services in service planning is because we know that all services, not just health services, but disability services, education, aged care, is better if the people who are the users of those services have a say in what they look like. And there's a really nice picture that we used that I've just put up to try and explain this. It's a picture of a park that has some very nice and well-designed concrete paths that have been put in. And to the previous speaker, who is a town planner, I know you won't be designing parks like this because you're interested in people's experience, because the other thing that this shows is that actually there's a very well-worn path where people have cut across the grass because that's the best way for people to use and move through the system. So one of the things, and so the next slide, please. One of the things I'm very aware of is that despite that, we live in a world that's dominated, unfortunately, by silos. And I have a picture up of a field that has 4 very neat and tidy and new-looking grain silos that are standing next to each other but not touching. And I think we live in a world where disability services are delivered in one area, education, for example, in another, health services in another, and aged care in another, and there are many more. But we don't live in silos. We live in the real world. And one of the things that I think groups like Health Consumers New South Wales and Physical Disability Councils, one of the things is that I worry about is sometimes we get trapped in other people's silos, and that we focus on what's happening in an area, but remember that people are using many different types of services, and we don't always bring everybody together, and we get trapped in other people's silos. So, and I think COVID-19 has actually given us a bit of an opportunity to move beyond that. So if we could go on to the next slide, please. Look, it's by no means perfect what's happened in the past year, but earlier on in the year, New South Wales Health established 30 different communities of practice, which brought together people with particular interest to look at some clinical aspect of COVID-19. But there were a couple of areas that weren't looking specifically at clinical issues. And one was the formation of a disability community of practice and a non-government organisation, communities of practice. And what these two communities of practice did was they actually allowed for people with disabilities and their organisations to be more formally brought into New South Wales Health discussions and decision-making processes than I think that they maybe have in other areas. I know there are some good connections, but it really strengthened that. And I think through that, it also allowed us here at Health Consumers New South Wales to develop partnerships and a relationship with some disability groups. So Physical Disability Council is an example. And through that, through these processes, we actually had some better communication that was happening at a structural level between community organisations, non-government organisations and the New South Wales Health Service, and consumer groups like ourselves and like the Physical Disabilities Council. And I think what that's allowed is that conversations that previously we didn't have the time to have has suddenly happened, and networks and relationships across different sectors have been allowed to develop. Now, I don't want to pretend that this is perfect because it's not, and we've already heard a lot of the challenges from people on the ground, but I think this gives us an opportunity to go forward and to break down some of these silos. So my last slide is just asking about what do we need to go forward. I think we need to build on and expand some of the partnerships that the pandemic allowed us to create. And when we move back into a COVID normal or whatever the new normal is, let's focus on those, on building those connections that this allowed us to make. We need to properly resource and support people with disabilities and the organisations who represent them, and that the organisation and their own organisations to engage with health services. We need to work to build people's capacity to work together. And we need to continue to build and strengthen the partnerships. And for me, this is the most important, between all those different consumer groups. So whether it's health consumers, disability groups, older people's organisations, students, whatever it is, we need to build those partnerships because we don't live in silos. And together, I think, by talking about our experiences and our shared experiences, we can make partnerships and knock down a few silos. So thank you very much, and I'm happy to join in the questions when we come to that.
Thanks so much, Anthony. I totally agree. The partnerships that some of us have made in this time have been absolutely essential to us being able to work well during COVID. Never before, as we said, has New South Wales Health been more on show than this year. We've seen senior officials at nearly every media briefing, in our nightly news and our daily COVID case counts. Stephen Stephen Davidson, Director of Social Policy Implementation, New South Wales Government Relations Branch, has been, dare I say it, immersed in the interface between New South Wales Health, the NDIS, and many of our organisations throughout 2020. I'm keen to hear his perspective of how health has seen the year out and what legacy he feels should be included in the future health provision of people with disability in New South Wales, or how working collaboratively this year has improved cross-sector relationships. Welcome, Stephen.
Thanks, Serena. Can you hear me now?
We sure can.
Great. And thanks for the introduction and thanks for the invite. And it's great to be here and to have survived so far under COVID, and to have seen some of the really significant changes that have occurred under COVID. Some of them extremely challenging, and that's a code for really painful and disruptive. Some of them actually really impressive, where people have come together to address those challenges. If I could move to the next slide. New South Wales Health, you're right, has been on show for all the good reasons that we have provided the public health response, but also some of the areas that showed up where the disruption showed up, our gaps. And I'll come to those, some of those in a moment. But some of the key issues that came up during especially the early part of the COVID response, where nobody quite knew where this was going or how it was going to pan out. And there was, at times, I think that there was real concern that this was going to be something which may overwhelm health systems if we got a very widespread epidemic, where it was something which, a bit like what is happening in the US or the UK now, where our hospital system would not be able to manage the numbers. During that period, I think that we quickly came to learn about what was going to challenge us. The first thing was simply access to PPE and training and how to use it and how to do infection control. Most people, myself included, know about personal hygiene and about protecting ourselves against infection from foodborne illnesses, from sewage, from other people's infections, and to manage our own infections. But this was a step up. This was a case of learning how to battle a new and different threat, which required us to do a few things very specifically, especially physical distancing, hand sanitizing or hand washing, different sneeze and cough etiquette, being able to manage our own illness so that we didn't come in contact with other people. That meant not coming into, for example, work. And very quickly that meant also fronting up and getting tested when required. And I'll come a bit to that in a moment. Because the testing was a real challenge. Setting up our testing for people without disabilities was a very significant challenge. But what I think did happen was that there was a blind spot for people with disability and the specific challenges that they faced. Subsequently, we've had lots of conversations with the blind community, the deaf community, the deaf-blind group, people with intellectual disability, and also people with psychosocial disability about the specific challenges which they've faced. It's the case that some people, for example, are particularly sensitive to having something shoved up their nose for a nasal swab, and no matter how much you dislike it, when you don't have, for example, an intellectual disability, some people with intellectual disability are really challenged by that intrusion, and it makes testing very, very hard. It was also the case that staff of the disability providers were really challenged by getting tested, because in many cases they then had to leave their post, and that left their providers short. It meant physically isolating, and so until they could get their results, which disrupted the rosters. And it also was a real challenge for providers to accept people back from hospital, where we knew that there was COVID in the hospital, but they needed reassurance that the measures we'd taken to ensure that the person coming home did not have COVID were sufficient to give them and the rest of the people in their facilities confidence that they could go on with their lives and not be subject to unreasonable risk of infection. There was lots of challenges in being able to get messages out to people, including just managing business continuity, how to keep going in looking after people, and how people with disability could keep their providers, keep coming into their homes, how people and whether people should go to day programs, go to work in ADEs or other employment, how they should do their community participation, which is really just code for how you do life, and especially around travel, what was safe and what wasn't, and when should we travel and when we shouldn't, and if we did travel, what we could do to protect ourselves. Protocols for the visits of people to group homes and PPE requirements when they're there became a standing topic of my week, and I think it became the bane of a lot of people's lives, trying to adapt to the changed requirements. We certainly learned a lot during the process, and one of the most important things that we learned was that we had to really be in contact with our sector, the disability sector, to make sure that we could get feedback from them, and that we were able to put things in a context which allowed people to learn about what they needed to do. If that's a wind up, I'll go as quickly as I can to the last page in a moment. I think the rest of the things that are on there were fairly obvious, but the last point I'd make, it was really important. This need to have an emergency response plan, and how New South Wales Health and other mainstream agencies interacted with the NDIA and the NDIS Commission. And we built up a very good relationship in relation to the outbreaks, but I think we need to build on that for the time going forward. If we could go to the next slide. There's a list of some of the things that we did, especially the disability community of practice, webinars, forums, easy read resources, this weekly guidance we sent out by letter and also on our web, and easy read versions of the public health orders. We also had quite a lot of new content on our disability microsite, on our health website, and that was a really great collaboration with the Council for Intellectual Disability. And I would refer you all to those resources, because I think they're a great guide, and you can pick them up and use them as you wish. But they did also highlight the fact that accessible communication is critical, not just within a pandemic, but and not just within emergencies, but also within our business as usual, our everyday work in our health services. It's really important that we anticipate and that we meet the needs of people with disability. And when I say that, it's not just people who are NDIS participants, but remembering that disability has so many faces. As we age, there can be incremental disability as when we're younger, and when we are temporary disabilities. There's a whole range of opportunities for us to do better, and we've certainly been learning fast and I think quite deeply as the process goes on. We've been really helped by the extraordinary generosity of people with disability and the peak groups in helping us to do better. If we could just go on to the last slide. And there's a list of things which I think are legacies. Yep.
I'm so sorry to interrupt you, and I'd love to come back to these. I've just got the minister on the line and he needs to move to another meeting at 3:30. Would you mind if we jumped across to him briefly and then come back to you?
I am very happy to step aside for the minister.
I'm sorry to do that to you.
much.
Thank you, Serena. I'm very sorry to do that. It's as you can imagine, it's a great day and lots of celebrations, and I'm just trying to move around as many as I can. So I do apologise. And look, can I start by acknowledging the traditional owners of the land of which we're on, and can I thank you, Serena, for inviting me to be here to speak at this event and allowing me to share the agenda with such a distinguished and thought-provoking group of people. And can I thank you, Serena, for all the great work that you're doing advocating for people with disabilities, not just in the past, but certainly your great work that you're doing at the moment and into the future. And can I start by wishing everybody a very happy International Day for People with Disabilities. It's been a different but equally enjoyable day this year, as I've been able to attend virtually and in-person events all throughout the day, and to meet and listen to lots of amazing people across our sector. The theme of this event, as I understand it, is building back better towards a disability inclusive post-COVID 2019 world, and what a year we've had. The word unprecedented gets chucked around a lot in 2020, but that's because there really isn't a better way to express how extraordinary this year's been. 2020 has torn up the entire rulebook in so many areas of life, and I think it's only appropriate that we consider how to take the changes brought on by the need to respond to COVID and turn them into a legacy of innovation and inclusion. There's so many things we've learned to do differently. Our backs have been against the wall and we've had to innovate, and a lot of those ideas have been frankly inspirational and game-changing. Our government has responded to COVID through placing the welfare of our citizens, our state, at the forefront of everything we do, and the needs of especially vulnerable populations such as those covered by my portfolio have been and are continuing to be addressed through the ongoing commitment of thousands of people across the state, including many of those viewing this conference today. I'd like to thank those people for their tireless work and effort. It doesn't go unnoticed. In fact, I moved a motion in the Parliament congratulating the social services sector more broadly. Now, as I'm sure watchers of state politics would know, rarely does anything go through the chamber unamended or without some sort of opposition, but members poured into the chamber to talk about their personal stories about the social services sector, and to thank the front line, the administrators, the CEOs, everybody. And in fact, there was a similar motion following my motion in the Legislative Assembly, in the Legislative Council, and again carried unanimously. Throughout this pandemic, the government has also been working with our counterparts in the Commonwealth and other states and territories to ensure clear and consistent direction and leadership. Our state has already applied lessons learned from the Victorian experience to the New South Wales context through the establishment of the COVID New South Wales response plan to support people in specialist disability accommodation. The plan was developed in consultation with New South Wales Health, my department and the National Disability Insurance Agency, the NDIS Quality and Safeguards Commission and key supported accommodation providers. The pandemic has highlighted the need for us to be able to identify particularly vulnerable and isolated people with a disability. Last month, I convened a meeting with Graham Head, the NDIS Quality and Safeguards Commissioner, and Mr Robert Fitzgerald, who's the inaugural New South Wales Ageing and Disability Commissioner. We discussed how the Commissioner will work with the NDIS in New South Wales, including the Ageing and Disability Commission, to implement faster and more reliable ways of identifying and safeguarding vulnerable NDIS participants in our state. Now, this includes identifying better ways for collaboration and data sharing between my agency, the Ageing and Disability Commissioner, the NDIA and the NDIS Commission to ensure the safety and quality of supports for NDIS participants in New South Wales. COVID has also led to a large-scale shift in how we work in New South Wales and across the country. Some of the changes are here to stay, and many of them are to be welcomed as they are positively life-changing for people with disabilities, particularly those with physical disabilities. I've certainly noticed in my own work as someone who is legally blind, how it can actually empower you to use things like Zoom. I don't drive. It's easier to move around a computer on a Zoom meeting than get in and out of venues and cars, and it just makes life so much easier. For me, the changes we've implemented over the past 12 months haven't all been negative because I haven't been travelling around the state as much as in previous years, but I've been able to meet with literally thousands of people, providers and sector leaders, to make sure we stay across the issues and respond quickly. I don't think I've ever met with as many people as I have this year because of those changes. And I've heard from people with disabilities who may have previously had difficulties just travelling to work about how much better working from home has been for them. I know that the novelty for some might be wearing off, but certainly for many it's been very empowering. I'd like to thank again, Serena, you for your work in convening this event and for also allowing all of us the opportunity to build a post-COVID way forward for people with disability. Serena has also tirelessly campaigned for the continuation of disability advocacy funding in New South Wales, and I was really pleased to be able to announce in the most recent budget the continuation of advocacy funding as we await the results of a number of Commonwealth reviews into disability advocacy funding and consider in tandem the recommendations of the Ageing and Disability Commission's report on disability funding in New South Wales. This has been, I know, something that's attracted a lot of controversy, but I know that the people that have been agitating have been doing it from the right place, and I hope that the budget announcement perhaps proves to some that I was always on board. I just needed to get the agreement from the government, and I was pleased to be able to do that, along with the broader package of disability advocacy and inclusion funding, and also the sector funding to boost disability employment, so that we do have stronger services with continuity and quality. And that was, I think, a bit unexpected from many, but I'm sure everyone would be happy with that investment. These are not costs to government, they're investments in vulnerable people. Our government feels very strongly about it. I hope that Gladys's appointment of me as the Disability Minister is indication enough that we genuinely want to make things better. Thank you again for the opportunity to participate in this exciting forum as we look at the post-COVID, well, hopefully post-COVID world, knowing that we have learned valuable lessons that will take us into the future in a freer and more confident and indeed more inclusive society.
Thanks so much, Minister. We really appreciate your time. A really quick question, if you've got 10 seconds. Or have we lost him already?
I think he's still there. He's still on mute.
Minister,
there we go. Sorry, I was just having trouble with technology. Sorry.
That's okay. I know you mentioned a couple of things that you really appreciated. Was there anything specifically for you as a person with disability that surprised you in a positive way out of this time?
Look, there's a couple of things actually. One's a bit more broad, and look, that's just the way our communities have responded and come closer together. You know, I don't know about you, but I mean, I'm lucky. I know my neighbours. I love them. They're great. But I know plenty of stories of people that have been living in places for 5, 10, 15 years and don't even know their neighbours. That's changed. There's something that's changed in the community. And, you know, for those of us that remember the Olympics, there was a real sense of pride. And I've noticed that across our state too, about how we've responded to COVID. And, you know, it's not just about looking at other states. I've certainly never looked down my nose at the way other states have responded. I know that some people have tried to politicise it. I've only felt compassion for states that have had their challenges. But I do think there's a sense of pride in our state again about how well we've handled this. And I think if I can just speak more metapolitically, I think that there's been value seen again in state governments, because I think a lot of people have said for a long time, if you were going to rewrite the Federation, you'd chop the states. Well, I hope that people realise the value of states after what we've just been through. But as a person living with a disability, Serena, look, I just, as I mentioned in my comments, I've found, I mean, I need to be in front of computers to read and do things. If someone puts a document in front of me, I can't see it. So for me to be able to blow things up while I'm on a Zoom call, to share documents with people that I can read and talk to as part of meetings, to be able to participate on the same playing field is extraordinary. And, you know, even as a parliamentarian, indeed as a minister prior to COVID, I still struggled with that. So to be able to do that, I think is really empowering. And I certainly felt a greater degree of confidence going into meetings with, you know, Commonwealth ministers, premiers, other colleagues, because, you know, I was on the same playing field. And, you know, it's not often you get to say that with great confidence, but I felt much more confident, even though outwardly I probably always appear to be very confident. You know, sometimes you do struggle and you do worry, and you worry that you're going to miss something. And I haven't felt like that throughout this period.
Thanks so much. And in the workings of government, was there anything behind the scenes that you would really like to see continue?
I'd like to see the communication continue. I think that there's been more communication across the sector in the last 12 months than I've ever seen. And I've really appreciated building up stronger relationships or building new relationships. I think that broadly the sector probably feels they've probably had more access to me than that ever probably wanted. And I think that's been helpful. I mean, you know, I've certainly appreciated the direct advice rather than having to schedule meetings and see people face to face, to be able to jump on a Zoom call. It's really changed the attitude and timeliness of decision making. I think that's been a positive thing.
Perfect, thank you. If anybody else has questions, pop them in the Q&A. I'm not sure if the Minister has time to stay and answer any more himself, but all our other panellists are online, so by all means, please throw questions at anyone. Minister,
I've got about 3 more minutes, Serena. If anyone wanted to ask me a question, I'm happy to take one.
Perhaps we might even be able to unmute our attendees and see if there's someone that wants to jump in.
Minister, it's Stephen Davison from Health. Can you talk a little bit about the DIAP changes that you announced today?
Yeah, look, thanks, Stephen. Look, what we've announced today are changes to the Disability Inclusion Action Plans to make them more inclusive and more consultative. Look, they were a great innovation in 2014, but obviously we live in a very different world now. The NDIS is a feature and the Act needed a review. What we've certainly done is put people with lived experience at the heart of these plans. I think that these plans were often worked up by departments and councils. They didn't actually see the consultation as needing to be genuine. I think it was more a ticker box exercise, but what we've done is add a level of transparency and accountability around these plans that mean that, you know, be it a target around employment, be it a target around service delivery, we actually now have the capacity to hold agencies and councils to account. But by encouraging people with disabilities to be at the centre and mandating that through the changes to the DAPs, which I think you know, is how it should have always been. But, you know, like all reform journeys, you know, there's always a pathway, and this is a really positive improvement that came through the consultation on the Act review. It came through the comments from the Disability Council, and frankly, it was my own view that I thought these plans were a little bit flimsy, a little bit weak, and we needed to give them some real teeth, and that's what we've done.
Fantastic, and it is really great to hear. We obviously would like to see a little bit more beefed up and consistent DAPs, Disability Inclusion Action Plans, for those that may not know our acronym, and to be able to see and report back on them in a consistent way would be fantastic. Minister,
and that's exactly what the changes do, which is tremendous.
Great. There's a really, really important question in the chat, and one of my members has asked, Minister, what are you doing for Christmas?
Well, I can tell you, every year I have a gathering of family and friends on Christmas Eve, and then we roll off to St Luke's Anglican Church in Bury. And can I tell you, I'm always in very strong voice after a few drinks at the midnight service. Then we get together as a family and share Christmas together, and then I've got a Boxing Day catch up with a group of friends I went to high school with, and that's been happening for years. But I literally have not taken a day off Saturdays, Sundays this year. It's been a really pressing year, but I'm not alone. There's been so many people that have worked hard, from the front line to the back room to ministers and premiers. So I'm going to be taking some really valuable time with some people that were there for me before I went into politics. And they'll be there hopefully after I leave, whenever that may be. When you've got cousins saying to you, if we didn't watch the television news, we wouldn't know what you look like. You know you've got to reconnect. But I'm really looking forward to Christmas this year, Serena. It's been a really hard year, and I can't wait. I've noticed that the decorations are going up earlier than ever, and I think that's because people want to edge towards the end of the year. And as I think I might have remarked earlier, I'm not having a New Year's Eve party. I'm having a Get Knotted 2020 party, I think, at the end of this year, because we've all had enough.
I'm just unmuting. I agree with you absolutely. I think we're all ready to see the back end of the year. And that question was from my very cheeky president, Mr. Chris Sparks.
Oh, well, he's a wonderful man. He is cheeky, but he's still wonderful.
I believe Susan Thompson may have a question.
Yes, thank you very much for the opportunity to have a quick word with you, Gareth.
No worries, Sis.
We've sat across a lunch table before.
We have indeed. Nice to hear from you again.
You too. Look, what I'm interested in is, we've heard all about today about all the technological benefits that we've utilised during the COVID, and as you rightly said, many of us who are blind or have low vision have also benefited. But I think in order to build on this, there's going to need to be within probably, I guess, the DAP and the DIP and the DAP process, this disability action plans, a much more specific and practical focus on accessible ICT procurement, so that, for example, people don't suddenly have to deal with an online system with government that they don't know how to use and don't even know if it's accessible.
Look, I totally agree with that. And can I tell you, Susan, one of the things that I'm going to be doing when I see the departments develop their DAPs and councils their DAPs in the new format and environment is I'm going to do a bit of a survey on my own and have a look at whether or not there's that level of detail there. And if it's not, I mean, these documents shouldn't be, okay, we've done it, we've ticked a box. They need to be living documents. They need to be responding to exactly the sort of things that you just raised. And if they're not, I'm going to get cranky about it, and I'm going to get on the phone to people, and I'm going to say to secretaries, what are you doing about ITC? What are you doing about employment? Because I think that's what a disability minister should do. That's where I want to see this go. I'm going to obviously put it into the court of those people that are the existing stakeholders inside a lot of the departments, and I think just about every government department now, and I'll be corrected if I'm wrong on this, has a disability advisory committee. So I don't want to tread on the toes of those that are already there, but I also want to empower them to be brave and be bold about these plans so that they do raise the bar, not maintain the existing status quo.
Wonderful. Serena, I have a quick question, if that's all right.
I'm sure the Minister will give you the time, Cecile.
Yeah. Hi, Minister Ward. It's Cecile Sullivan-Elder from Family Advocacy. How are you going?
Hello, Cecile. I recognise the voice a mile away.
Berry Church is a lovely church. I've been there on New Year's Eve, on Christmas Eve myself.
Yeah, it's a great spot.
Yeah, no, just a question in relation to the Disability Inclusion Action Plan. It's great that you're thinking around boldness and braveness, and I'm just wanting to get your feedback on the intentions around aligning it with the UN Convention, which is the intention of that, and what your thoughts are around making sure that's safeguarded in the process.
Well, we're obviously as a nation a signatory to the rights of people with disabilities, and so I expect all governments, local, state and federal, to be aligned to those principles. And there's national reporting mechanisms on that convention, as you'd be aware. So, I've read that convention. It talks about access, it talks about equity, it talks about inclusion. It's hard to be specific because it's a global document, and I mean global in the total sense. But yes, I expect that those principles to which Australia is a signatory to be running right through these DAPs. I hope that people are courageous as part of these plans, and I hope that there are some difficult questions that CEOs are having and that secretaries are having as part of these discussions, because we're still falling behind where I'd like us to be on things like disability employment. I think as a state we've made a commitment, and I'm going to start getting very cranky with ministers and other secretaries that haven't met those targets. That's really important, but also accessible services. I mean, I think I have to say the one minister that I think that's done a really good job in this area, because it's not all doom and gloom, is actually Andrew Constance, who has been a former disabilities minister, and the investment he's making into disability accessible transport is the biggest the state's ever seen. It's an $860 million investment into transport access, and he should be committed for that. So there's a lot of good things happening, but I want to make sure those obligations that we have are met and, where possible, exceeded.
Good to hear. Thank you.
Minister, thank you so much. I know you're getting the wrap up from inside your side, and we really
I've got James looking at me in a very scary fashion because it just means I'm going to be late for the rest of other things. But look, thank you, everybody. Merry Christmas. Have a great New Year. And apologies, Steve, for cutting across your presentation.
Not at all. Thank you, Minister.
See you. Cheers.
Thank you so much, Minister. Have a good day. Stephen, I'm going to come back to you briefly. I've got one question in the chat for you as well, and I know that you were about to talk to some of this. So perhaps me asking this question will give you the time to tell us those responses. It is one that says, whilst it's been a tough year for many of us in New South Wales, can you give us an insider's view on what worked well for both the department internally and across the state?
I will, Serena, and I'll be quick because I know that there's other people to speak. Can I just say, there's a list there of things which I think are legacies, and some of the things which I think are negative legacies, which we have to deal with. The inside story for health is this. It was actually a really impressive time in seeing people come together and really putting aside any siloed mentality about roles and responsibilities, and all pitching in to do what was a very challenging task. I think some of the key things were the speed of communication and the informality of the way things happen. That brings with it risk. And so in some cases that meant that we had to be really careful about making sure about the communication landed properly and people knew what was going on. And that was really difficult. And you can see that I won't talk about politically sensitive issues like Ruby Princess or Victoria or South Australia, but what I will say is that so much of what we do rests upon being able to communicate and make sure that that communication works for everyone. And I'll articulate that with the need for New South Wales Health and every other government agency and government in general to lift their game in regard to accessible communication and make sure that when we're designing, we design first around people with disability so that we ensure that they won't be missed. One of the things which I think that we are going to be challenged with now is making sure that as we go into whatever you want to call this COVID 2.0, that we are mindful not to lose any of the lessons, that we keep people with disability as knitted in and as integral to the designing of our services and the feedback mechanisms to make sure that they work properly for everyone, and that we put into practice all of the things which we've learned so that we improve both the experience and the outcomes for people with disability. And that, I think, is going to have ripple effect through to the rest of the community. So if there's a key inside story on this, it's that it's revealed a whole lot of very interesting and sometimes confronting information about our own services. But personally, I've been so impressed by how much cooperation there's been from the sector, from the peaks, from people with individuals with disability, from the families, from the providers. Literally, I can't point to someone who I think has let us down, and that's a really nice feeling. Back to you, Serena.
Thank you so much, Stephen. I appreciate the fact that we have really messed up your presentation by stepping in the middle, but I was getting a little bit of a push. I have to say in all of this that PDCN in particular would give New South Wales Health probably the lead on the way that you cooperated and communicated with our sector. Certainly having the COPs, the communities of practice across all those very areas made it a really, really easy place for us to be able to bring our issues and work side by side with you to actually try and make heads or tail and improve the situation for people with disability. I realise that we're well out of time. It looks like the questions are over, and I would like to take this opportunity once again to thank all our panellists. There are still some on the line and I know they've waited patiently, so thank you so much to Stephen Davidson from Health, Anthony Brown from Health Consumers New South Wales, Cecile Sullivan-Alder from Family Advocacy, Meredith Lee from ACAN, Susan Thompson from Vision Australia, our individuals as well, Cormac, who had to disappear and catch a bus home before he got in trouble, Jacob Cross, PDCN board member, and also another person giving us our his individual experiences. I really hope that through this we can take on board some of the learnings and improve the situation for people with disability, but everybody to be fully included members of the community. Have a fantastic International Day of People with Disability, and thank you so much for joining us this afternoon.
Well done, Serena and Hayley, everyone there. Great work.